y'all want to go back over here, is the hyper and hypomobility test. So I gave you sensitivity and specificity for the subacromial pathologies on page 6. So that's for studying and that kind of stuff. All right. So I'm going to ask you, Hillary, capsular testing. Did they do shoulder dislocation instability tests?
I honestly don't remember.
Okay.
In the practice exams, I've seen apprehension.
Okay.
disorientation.
All right. So what are the 3 types of instability, Catherine? It's directional.
Oh, anterior, posterior,
And
and
one more.
I don't know. I don't remember the last one.
Anterior, posterior, superior.
I said anterior, posterior.
Multi-directional.
Multi-directional. Oh yeah.
Anterior, posterior,
You want to
multi-directional
think outside the
instability.
box.
Think outside the box on that one.
Yeah.
I was like, others.
Locked
So we have tests for all 3 of those.
Okay.
So multi-directional is going to be a composite of,
Yeah.
of multiple tests. So you're going to have to do a few as you do that component. But the easiest test is probably the Sulcus test. So what you're going to do is you're going to grab the elbow and you're going to glide it inferiorly. And you're going to look at the relative distance it translates relative to the acromion. So she put her shirt back on so we can use yours. All right. So when I do this test, they're usually sitting. Their hands are just hanging, just normal. So I'm going to palpate where the acromion is, right? There's the acromion. So I'm going to put my finger right on top of the humeral head. I'm going to grab her elbow. I'm usually in front of her, but for the video, I'm behind. And then I just pull it straight down. And I'm like, okay, I can get a finger in there. You go over and do the other side. Woo! I get 3 fingers in. That's a sign that she would have inferior. She doesn't have that, but if she did. They usually aren't symptomatic. Now, if they just had some instability, they might say, oh, wait. But usually this is a relatively benign test. You're just looking for differences in the amount it glides inferiorly. So that is assessing the ligaments on top of the shoulder because you're pulling it down. The superior glenohumeral ligament. So anatomy at the shoulder, middle glenohumeral, inferior glenohumeral ligament, superior glenohumeral ligament, is that testy type material?
Probably, yeah.
Okay. So the superior glenohumeral ligament is up on top, middle's in the middle, inferior is toward the bottom. The inferior is 2 bands. It's like a hammock. There's an anterior and a posterior band. Y'all know what a hammock is, right?
Yes.
So if you think about you laying in a hammock, the humeral head is you. And so the posterior band's on the back part, anterior band's on the front part. This is the board question. In a anterior dislocation of your shoulder, which ligament is most commonly torn? The answer is the anterior band of the inferior glenohumeral ligament, because you're abducted and externally rotated. All the stress is now, everything is rotated. So the inferior glenohumeral ligament and the inferior band get torn.
Okay.
It's not the middle, which is what everybody guesses wrong. Because your arm is abducted. If your arm's down at your side and it gets forward, somebody came to that way, that might tear your middle glenohumeral. That's not the typical mechanism. The typical mechanism is abducted, externally rotated, horizontally abducted. So it's the inferior. Bankart lesion, you all have that word?
Yes.
What does that mean?
Isn't that a superior anterior
Anterior, inferior.
or anterior inferior?
The exact
Yeah,
correct
yeah.
anterior inferior.
Anterior.
So on the labrum, it's tearing off that part of the labrum around 4 o'clock. So if 12 and 6, between 4 and 6 on the clock. Clock is facing me, not facing you, sorry. It'd be this way for facing you all, right? This is 12 o'clock, this is 3 o'clock. That's 3 o'clock, that's 6 o'clock. So between 4 and 6, that's the inferior aspect of the labrum. That's where the anterior band of the inferior glenohumeral ligament lives, and when you dislocate your arm, it rips off not just the ligament, but what is the ligament attached to? The labrum, and so you get a Bankart lesion. Dr. Bankart came up with this description back in the 20s,
Jesus.
right? So it's been around, people dislocated their shoulders for years and years and years, right? Fracture, yeah. Okay, so Bankart is a soft tissue lesion. So you can have, yeah, so there's a bony Bankart. So instead of just getting the labrum, they knock off part of the glenoid. That's a bony Bankart. You're all in the same right area, but it's all down in that inferior aspect, right? So if my hand's the labrum, all this area right here, I can rip off the labrum, or I can knock off part of that anterior inferior. If I knock off a big enough chunk, you ain't gonna fix them. They're gonna have surgery. 20%, 15 to 20% of the labrum's gone, of the bone is gone. They're gonna fix it. They're gonna do a Latarjet. Bristow or a Latarjet. Latarjet is the cool one now. They take the part of the coracoid and recreate your glenoid. They detach your coracoid. That's called a Latarjet French. The heel sac. So here's my humerus. Here's my labrum, or my glenoid, with my labrum, which is imaginary. I dislocate anteriorly, inferiorly. So I've knocked off this bone, and it bangs across here. It's a traumatic event. Whoop, boom. So you get a compression fracture on the posterior aspect of the humerus. So you're gonna have two bony lesions. You knock off part of the glenoid. You can knock off, compress part of the posterior aspect of the humerus. That's a Hill-Sachs lesion. Dr. Hill and Dr. Sachs, right? Yeah. Pain in the ass. All these doctors. But that's a compression fracture on the humerus. A glenoid or a bony Bankart is a fracture knocking off a chunk of the glenoid.
But
And
then
if-
the slap is like 10 to 6. Right?
Slap is the labrum.
The labrum. Okay.
Superior labral, anterior to posterior. So just like in your hip and other ears, anywhere where you have, this is meniscus in your knees. Might be a little bit more familiar, I don't know. But it's that edge of the tissue. It's where the ligaments live. They attach and they transition into the bone as they go through there. So it's this, the gristle in chicken
Okay.
at the joint. That's sort of the capsular stuff. Cool? All right, come on back over here. I need you to lay down.